every year, 4th February, we celebrate World Cancer Day. So the theme for this year, 22 to 24, it was Close the Care Gap. As we all know, there is a lot of discrepancy and inequities in cancer care throughout the world. So today, we are giving importance to cervical cancer. As we all know, it is the second leading cause of death in women in India. And it's a silent killer and 100% preventable disease. And if you see the statistics, one woman dies every 8 minutes in India. And if you see globally, in every 2 minutes, one woman dies with cancer cervix, which is 100% preventable cancer. So how are we going to prevent it? For that, we are going to get information on today's webinar, and it's a part of World Cancer Day celebration. So we have eminent speaker, Dr. Bharti Madam. We have our chairperson, Dr. Animesh, who are joining us and sharing their views and ideas on this HPV vaccination, which is an important issue and topic which everyone should be knowing today. So at the outset, I request our Honorary Secretary, Dr. Karunakar Sir, to deliver the IMA prayer.
Thank you, Madam. Thank you so much. Good evening, everybody. I think Dr. Geeta, Madam, has introduced the topic very well already. We know that I was just reading some WhatsApp message. I know how true it is actually. Somebody has posted in one of the group that my finance ministry has announced that all girl children is going to be given free cervical cancer vaccine from Government of India. I think a lot of things have been done. I think in a bigger sense, it's going to improve the health of the country, the economy. Everything is going to be improved with this one single shot of decision of giving HPV vaccine to the children. Actually, I think it's a great initiative. I must also take this opportunity to appreciate our wonderful committees, Public Health Committee, Academic Committee, and all these people who are planning to do various activities, including this important webinar today. I think it's after to actually, it's very timely with the way things are happening with budget, government taking initiative, PMA is making some impactful decision on that. A lot of things are there. I think we're very thankful to you on behalf of IMA KSP. Let me start IMA prayer and hand over back to Dr. Geeta Madam. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ, ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಲಿ. ಜೈ ಹಿಂದ್, IMA ಚಿರಾಯುವಾಗಲಿ. Thank you so much, Madam. It's over to you again.
Thank you, Karnakar sir. So for today's webinar, I welcome our state IMA KSB President, Dr. Srinivas sir, who himself is a pediatrician. So we have our president who is a pediatrician, our honorary secretary who is a pediatrician. So what still we want for this topic on HPV vaccination? So we wholeheartedly welcome Dr. Srinivas sir for this webinar. I welcome Dr. Karunakar sir, our honorary secretary, for this webinar. Then the most important, I welcome the speaker of today, Dr. Bharti Rajshekar, who is the president-elect of Karnataka State Obstetric Gynec Association and also renowned consultant OBGYN, who is very active, and also she is very active in IMA too. So I wholeheartedly welcome on behalf of IMA KSB, IMA AMS, Bharti Madam. I welcome our chairperson for today, Dr. Animesh Jain, Professor, Department of Community Medicine, Kasturba Medical College, Bangalore. Dr. Animesh is also a very active person who is in the community field, and also he is a very active member in IMA too. So very much welcome to Animesh sir. I welcome our past president, Dr. Lakpol sir, and each and everyone who has joined for today's webinar. So without an delay, let us start the webinar. So first, I request our President of IMA Karnataka State Branch, Dr. Srinivas sir, to say a few words.
Yeah, good evening, everyone. Actually, it is very close to my heart, this HPV vaccine. And I have to thank our Dr. Geeta Zoppa for selecting this topic. I have to thank Bharti Rajshekar for doing great job in talking about this HPV vaccine. Actually, 3-4 years back only CWS meeting, I only spoke with Dr. Jailal when he was the president to fight for this, sir, to let the Indian government should make free of cost, and I made it. And also, when my presidential action plan also, I written that that we have to make free of cost this HPV vaccine printed. I have written that, and also I spoke to Dr. Dinesh Kundurao also to make this availability also, and our headquarters also written letter about this also. At that time only 2-3 Deccan Herald and 2-3 papers also I got it printed about that. We should make all adolescent girls to receive free of cost this HPV vaccine. So anyhow, it is very, very fortunate that our girls is going to have free vaccine, and the Modi Sahab, he has announced, actually Prime Minister, and he only contributed this for girl children. And you are very, very thankful to him also. And today's topic very well selected. This HPV vaccine prevention of cervical cancer, and especially for gynecologists and pediatricians, very, very close to their heart, especially HPV vaccine. We have started almost nearly 10 years back only we have started to give this vaccine. Anyhow, madam, I wish this program all the best, all the successful. So definitely I am very proud of that. Today's vaccine course that is taken HPV vaccine. Thank you one and all. Yes, so I will hand over this one for you so you can continue this program, madam. Thank you. Thank you one and all.
Thank you, Srinivas sir. Yes. So now I will introduce the chairperson of today's program, Dr. Animesh Jain. So he's the professor of community medicine in Kasturba Medical College, Mangalore. He is the head of Mangalore Unit of International Chair in Bioethics. He is also the honorary professor of Indian Medical Association, headquarters New Delhi. He is the EC member of IAPNSM National for this 23-24 and vice president of IAPNSM Karnataka 23-24. And he is has served in many posts of IMA Karnataka state committees like Medical Education Committee, Academic Committee, and they have done extensive work while in that committee. He was the honorary secretary of IMA Mangalore for 2 terms, and also he has received many awards, and he's the editor of the few journals and the faculty of FAIMAR Regional Institute Coimbatore and Manipal, India. And he's a life member of various associations, and also he's a very good academician. So over to you, Dr. Animesh. Kindly take over the program.
Thank you, madam. May I have the CV of madam, or shall I? Yeah, it's there. Okay. So as you can see that we have a very, very accomplished speaker today, and I'm very happy to be here in this program. Thank you to IMA Karnataka State Branch, and especially Dr. Geeta ma'am for giving me this opportunity. I think I'll straight away go into this, because as we all know that HPV is a very, very important, HPV vaccination is a very important step, and government is now going to make it available to everybody. So I think there's a lot of apprehension, a lot of confusion, not just among the public, but also among the medical community. And I think this is a very timely and apt webinar. Let me introduce you to the speaker. So Dr. Bharti Rajshekhar is a very accomplished person, and already been said that she is an obstetrician and gynecologist. She is also the president-elect of KSOGA, that is Obstetrics and Gynecological Association of Karnataka State, and she's going to shortly take over in April as a president. She is also active in Indian Red Cross and the director of Hassan chapter of Indian Red Cross. And very interestingly, she is vice president of the Karnataka Private Medical Establishments Act, that is KPMEA, and she's been actively involved in a lot of IMA activity, not just in OG Society. Of course, she's also the past president of Hassan chapter of the Obstetric Gynecological Society, past secretary of that. She's also PCPNDT committee member, and currently IMA state past vice president, as well as she's been a women's doctor wing EC member at the state level. She's been awarded multiply with so many awards. I would just mention a few notable ones. She's got President Medal from the Madras Madras University for final MBBS topper. Then she's also had a Foxy President Rotating Trophy as the secretary of Hassan branch of Obstetric and Gynecological Society, DK Tank Award, twice as the secretary and president, one of the rare distinctions. And notably, she's also been a recipient of Rajyotsava Award for work in the healthcare in Hassan. And she has conducted cancer screening, cervical cancer screening camp, screened around 5,000 women. She's very passionate about this topic. HPV screening camps have been done. And then she's also been involved in HPV vaccination free of cost for the immunocompromised. So if you can see, and she's very actively working in this particular that topic that we are looking at, and awareness camps has also been conducted for cancer prevention. So very aptly, we've chosen the speaker. Of course, she has many interest areas, but notably among non-communicable disease and also adolescent health and health of the women, especially with high-risk pregnancy, and also looks at preventive oncology and geriatric health. She is also interested in family welfare and contraception. And Foxy, again, she has been very, very actively involved. So very briefly to introduce, I think we have a very apt and good person who's experienced, who's passionate, who's very accomplished and well-read. So I think with that, let me hand it over to Dr. Bharti. We are all waiting to listen from you and learn from you, Dr. Bharti. Over to you.
A very good evening to all my dear friends. Dr. Animesh, I thank you for that very detailed and very nice introduction. And I thank the IMA KSB President, Dr. Srinivas Prasad, Dr. Geeta Doppa, the Indian, the IMS chairperson, and all the esteemed office bearers of IMA for having me here. And I have been, as you said, very closely associated with the Indian Medical Association since many, many years. But it's of late that I have just deviated towards my own specialty, thinking that we can do more. We have a lot of very eminent personalities in the IMA who will be carrying on the other work, but I can focus on something that is focusing towards women's health, because women are part of the neglected health sector in women's reproductive health. And as Dr. Animesh, you said, this Cancer Cervix Mukta Bharat is something that we have been, all obstetricians and gynecologists have been dreaming since years. And today we are seeing a beacon of light here today. And as I said, HPV vaccination was available in India for the past 7 to 8, I would say almost 10 to 12 years. But we had the imported vaccines which were beyond the reach of many of the economically deprived sections. And in spite of those who had the ability to get the vaccination, there was a lot of procrastination among those who could take the vaccination, as you said, including our own colleagues who would not get it or even talk about it or even get it for their family members. And of course, we from the Foxy as well as the IMA had been sending repeated advocacy reports to the Government of India, stressing the need for including HPV vaccination in the national protocol and creating more awareness. And as said rightly by our IMA President, Dr. Srinivas Prasad, Dr. Srinivas, and we from the Foxy also did meet the central level ministers as well as the state level health minister, and somehow now we see that they have woken up to our call and they have started introducing, at least talking about HPV screening, and cancer prevention has been included in the non-communicable diseases program of the Government of India as well as the Government of Karnataka. But sadly to say, even today, most of our practitioners are not talking about prevention of cancers. So I would ideally say, let's make this a Cancer Prevention and Awareness Day rather than a Cancer Day. I think we need to rephrase this title for the day, given as not as Cancer Day, but as Cancer Awareness and Prevention Day. Well, keeping that apart, let me come to my topic. I am going to be focused only on cervical cancer today. Can I have the next slide, please? Yeah, I have the slide. Can I, if you stop sharing, I can try to share my slides. Is it okay, Dr. Geeta?
Yes, ma'am, you can share.
If you allow me to share, I will share my screen.
Yeah, please share.
Yes. Yeah, I have my PPT open here. Hopefully it should work. Slideshow. Yeah, is it visible?
Yeah, it's just loading, ma'am. Just 1 second.
Yeah, it's loading. If it's not, we can go back.
Yeah.
Otherwise, waste time. Yeah, fine. So I'm going.
It's open. Yeah.
So I'm sorry for that. it's more convenient for me to move the slides when it's there. So as you all know, this cancer cervix is a huge burden, not only in India, but globally, but definitely in the low middle income groups, like such as Latin America, Africa, and Asia. We have a higher incidence of cancer cervix, and hence the slides are not moving. Is there an issue? Oh, yeah. So let me go back. Oh. So now let's come to India, because now we are aiming at something called a Cancer Cervix Mukta Bharat. And it is so distressing to hear that one woman dies of cervical cancer every 8 minutes. So since the time we started this webinar, there's somebody dead somewhere. And it is the leading cause of death in Indian women, the leading cancerous cause, not other causes. Maternal mortality is also there. And very sadly, almost every second, it is the second commonest cancer in women in India, the first being the cancer breast. And India has a population of 436.76 million women who are 15 years and older. And out of that, we have these women who are at a risk of cancer. And most of them are in their very productive years of life. And the disease burden in India, what is it? About 185 women are dying every day, 8 women every hour, and every 8 women. So this is the alarming statistics, but still we as healthcare personnel and the government machinery as well as the political will is still on the lower ladder of the lower ring of the ladder. So cervical disease, as you see, in the world, we have almost this 493,000 women testing positive, and surprisingly and alarmingly, almost 27% of the world's global cancer new cases are from India, and almost 27% of the deaths globally due to cancer cervix are from India. So that is the alarming incidence of cervical cancer that we are having. And how can we prevent this? Well, you know that primary prevention is going to be by vaccination, but however, though that is a ray of hope, we have to continue with our screening methods also. So it is going to be a two-pronged attack to fight this scourge of HPV. And what is this HPV? Why am I talking about HPV vaccine today, and what does it have to do with cancer cervix? Well, you all know, we are all familiar with vaccines. HPV is one of the most criminalized, incriminating etiology for most squamous cell cancers of the cervix as well as other cancers. It is a very small non-enveloped isohedral DNA virus having a diameter of just 52 to 55 nanometers. It is a single double-stranded DNA molecule. It's a protein capsid with around 72 pentameric capsomeres. I'm not going to go to the details. But HPV is not just causing cancer. We have 150 genotypes of HPV, and in that they are divided into mucosal genotypes and the cutaneous genotypes and the high-risk genotypes. We have the high-risk genotypes and the low-risk genotypes in the mucosal genotypes. What are these high-risk genotypes? These are the ones which are going to cause high or low-grade genital tract dysplasia, cancer of the cervix, vulva, vagina, anus, penis, and oropharynx. Whereas the low-risk genotypes are the low-grade genital tract lesions like condylomas and recurrent respiratory infections. The cutaneous genotypes can cause benign skin warts, actinic keratosis, keratoxanthomas, and non-melanoma and non-melanomic skin cancers. So what are the high-risk genotypes out of these 150 genotypes that we have of cancer cervix? The HPV 16 and 18 are the high-risk genotypes which are known to cause cervical cancer, penile cancer, and oropharyngeal cancers. So we are more worried about the HPV 16 and 18. Of course, we have the low risk group such as the 31, 33, 35, 45, 56, 59, which can cause low risk for cervical squamous carcinoma as well as oropharyngeal cancers, and the others are 6 and 11, which could be causing the genital warts and oral hyperplasias and oropharyngeal cancers. So now that we are talking about HPV vaccine, we are always talking about the women and the girls. But let us be alert that HPV infection affects men and boys too. It can cause genital warts, penile cancers and anal cancers and oropharyngeal cancers in both genders, and increased incidence of cervical cancer and vulvar cancers in the female gender. So how does this cause? Infection by HPV infects the epithelial cells in the cervical mucosa or any other mucosa. The DNA gets integrated into the cellular genome, and that causes replication. There is viral replication when the person gets infected. But if the immune response is good, there can be a regression of the viral replication. But in replication, in few of them, when the immune response is less, there can be a persistence of the HPV infection, and that causes viral replication. There are mitotic and precancerous changes, and over a period of 10 to 30 years, the HPV DNA gets integrated into the tumor cell DNA, and about 0.8% of this population will develop cancers. And surprisingly, almost every one of us, they say, would have been infected with some sort of a HPV infection in our lifetime, but most of them are transit infections. The body's immune response removes the HPV virus. However, in few of them, there is this HPV viral persistence, which is the cause of the cancers that we are talking about. So that is just the tip of the iceberg, but the remaining are just below the ocean. You can see that is we are not focusing on the other cancers which could also be due to the HPV. So HPV is a necessary cause of cervical cancer in more than 99.7% of cervical cancers. And what causes it? It is 16 and 18. The non-cancer ones which cause anogenital warts, especially in men, are 6 and 11. So that is why, how does this HPV spread? So it can spread by skin to skin contact, by any sexual contact, and it can be passed to a baby during the vaginal deliveries. It can be prevented by using condoms, regular STI testings, and of course vaccination. It does not spread by holding hands, toilet seats, swimming pools, sharing utensils, tubs, or hugging or sharing food. Know why it's not moving. Yeah. So WHO has awoken to this and given a global call for an action to eliminate cervical cancer, because it can be done. So elimination of cervical cancer as a global health issue is within reach for all countries. We know what works and we know how to prevent and control this disease. And we should be proud to say that Australia has been the first country to eliminate cervical cancer with effective screening technology and universal vaccination. So the call was given to eliminate cervical cancer in 2018, but now it has been extended to 2030. So there has been a target to be achieved for the Sustainable Development Goals, the WHO and the FIGO Global Declaration, which say that cervical cancer should be less than 4 per 100,000 women. 90% of our girls should be vaccinated. 70% of women between 35 and 45 should be screened. And 90% of our women with cervical cancer should be getting the effective treatment. So these are the goals which are to be achieved by the WHO, by the FOXI, and by the IMA, I would say. So the global strategy should be 90% of girls to be vaccinated for HPV by the 15 years of age, 70% of women to be screened with a high performance test by 35 and 45 years of age, and 90% of women to be identified with cervical disease should receive treatment for precancerous lesions as well as invasive cancer. So these are the guidelines we are supposed to do. And you see that in the Western countries, they have almost reached the targets of 90%. However, we have a very dismal figure in the Indian scenario. What is it showing? We have a very low rate of just about 0 to 0.1% of our girls being vaccinated, just about 3% of our women being screened by any effective method, and only 10% of those with cancers are getting complete effective treatment. So why is this happening in India? Well, I have already talked to you about this, but I will say the major factor would be a lack of awareness among both educated and uneducated. And there's a lack of commitment by the healthcare providers. There's a lack of infrastructure, and there's a lot of procrastination by the government machinery and the policy makers, because there is a very low health budget which is allocated, and that is causing us problems, and this increased suffering of women is going on in our country. And I would like to show this because when we talk about accidents, every day we are talking about 2 people dying in an accident or 10 people dying in a train accident, but we want to tell you that from years and years, an Airbus full of women are crashing every day in India and dying just due to cancer cervix, leave alone the other problems they are dying due to. So how do we eliminate cervical cancer? This comes to our job today. So we have to vaccinate, we have to do lifestyle modification, and we have to do regular screening. But in the purview of my talk today, it is going to be only the vaccination. Maybe if time permits or if the organizers permit, we can talk about a few slides about the cancer screening of what is available. Okay. So how does the HPV vaccine work? So the vaccine is introduced into the viral live proteins when we inject them. The body produces antibodies to these viral live particles. And if HPV enters the body, the immune system produces those same antibody effects and removes the infection, as in any other vaccine, as all of you are well aware. Because there is a very long period of transgression from infection to cancer. So we can target the women and the girls before they get the HPV infection, because we already said that it is usually due to sexual contact and during childbirth. So the earlier the better. And most of the healthcare personnel and even those who come to us for vaccination have one question: is it safe? Is it safe? So the quadrivalent HPV has proven effectiveness that provides long-term protection for age groups from 12 to 26 years, even after 10 years of vaccination. So that is the safety protocol. So it is a high impact vaccination, and 20 deaths are averted per 1,000 who are vaccinated. That is the potency of the HPV vaccine we are talking about. So when do we give this HPV vaccine, and to whom do we give the HPV vaccine? The primary prevention is the most important step to eliminate cervical cancer, recommended for both boys and girls. As I told you, we just have a ray of hope now because the government has announced vaccination for girls from the age of 12 to 15, at 12 to 14 at this present moment, probably due to cost constraints and logistics. Probably in the days to come, we will have that all our boys and girls in the adolescent age group will start getting vaccinated, as it is done in the Western countries. So we have to start talking early. That is, the pediatricians, the family physicians need to come here and start talking early to the children, to the parents, at as early as 9 to 10. The CDC recommendations and Foxy recommendations and WHO recommendations say you can start vaccinating them as early as 9 years. So you can start talking early. The actual on time would be when you give them from the age of 11 to 12. Late may be around 13 to 14 years, and again late will be 15 to 26 years. So in the early stage, that is 9 to 14 years, the CDC and WHO recommend 2 doses of vaccine given 0 and 6 months. So that is the first protocol we follow. Those who are above 15 years, we need to give them 3 doses. That's going to be a 0, 2 month and a 6 month vaccine is supposed to be given. So that is going to be the vaccination protocol. So 2 doses for those below the 14th year and 3 doses for those who are above 15 years. So we had the bivalent vaccines and the quadrivalent vaccines. Well, the bivalent vaccine Cervarix is right now not in the market. It was available a few years in the Indian market, and we were giving it for some, but now we have jumped to the quadrivalent and the nanovalent vaccines. So I will be talking about the Indian vaccine in the next few slides. This is an older slide. Gardasil, which is by MSD, was the only vaccine which was available as a quadrivalent vaccine against HPV 6, 11, 16 and 18, and it was recommended for males and females from 9 to 26 years. Then we came the Gardasil 9 or the nonavalent HPV vaccine, which was recommended for 6 and 11 along with 16, 18, which are 4 high-risk groups, and 31, 33, 45, 52 and 58, again for males and females from 9 to 26 years. So for many years, in the recent past, we were having only these 2 vaccines. So this 11 to 12 years was the best time to give the vaccine when the boy is in class 5, because they have a higher immune response to HPV vaccine than the older teens, and the immune response is going to be very good in these children. So this was the recommendation, and the pediatricians do call it the cancer vaccine. But I would like to say, please do not use the cancer vaccine very bluntly on anybody's when we are doing the counseling, because it just causes a lot of intimidation and they will take some time to decide. So I think we have to put it across to them very subtly and tell them why it is to be given and how it will prevent. So why are we going to give it to the adolescents? Because when we give it to the adolescents, there is a higher immune response, there is a higher risk of acquiring, because very often I always tell my adolescents to take the vaccination when they are 15 or 16, and then one fine day after 3 years, she comes back around 18 and a half or 19 years telling me that she has amenorrhea 1.5 years. Her case record has the slip saying take HPV vaccine, and we have a pamphlet I give to all my patients, but she will say, doctor, madhve madbitvi, madhve agoitu, now she's already 1.5 months pregnant. What do I do now? Of course, she's going to continue pregnancy, but she has lost that golden opportunity and the very, very safe window when she has to take the vaccination at 11 to 12 years. And of course, the cost of immunization is going to be very less when they take it in adolescents. And various studies have shown that the risk of cervical cancer for those who are vaccinated before the age of 18 was very, very low than those who were unvaccinated. So that is the scientific studies which are showing the earlier you vaccinate, the immune response and the risk of cervical cancer is going to be, or even pre-invasive lesions are going to be very less. So let us start early. We need to talk to them from the pediatrician's consultation chamber, I would like to say. So why are we giving the quadrivalent HPV vaccine and not the bivalent vaccine? Because it provides protection of cervical, vulvar, vaginal cancers, precancerous and dysplastic lesions, as well as genital warts and condyloma acuminata. It is efficacious even in mid-adult women. It provides long-term protection. It has got safety in lactating mothers, and there is a very safety licensure protocol. So this I've already told you that once you give the quadrivalent vaccine, the prevention of cervical cancer and precancerous lesions are almost as high as 98%. Vulvar and vaginal precancerous warts can be protected up to 100%, genital warts almost 99%. That's because we can't say 100%, that's why we are saying 90%. So now what is the role of our family physicians, pediatricians, obstetricians and gynecologists in providing the proper platform and creating awareness among our population? Well, I for one talk to every person who walks into my outpatient, whether they come for pregnancy, whether they come for a menopausal checkup, or whether they come for any other abnormal uterine bleeding, and they are accompanied by their daughters or they're accompanied by their husbands or mothers. I take 5 minutes. We have a flyer pamphlet talking about cancer awareness. We talk to them about vaccination, and we tell them, please take this pamphlet, post it in your WhatsApp groups, share it with your family members, share it with your friends and relatives, and spread the message. So I request each one of you to take 2 minutes to talk about HPV vaccination, cervical cancer screening, breast cancer screening in women, and for men also a health checkup, as well as you tell them to get their cancer screening technology also done for them. So this is what I would like to tell all of you. So, and when we are counseling, just a minute, please. Yeah, I got some pop-up here. Is it seen? Some pop-up is coming up. Yeah, sorry. So when we are counseling, we have to be very, very careful. We have to use small, short, and 6 small responses. So let's be precise, short, meaningful words, not using a lot of science jargon because they get intimidated by that. Just take about 2 to 4 short sentences and talk to them quickly. Make it just about 15 seconds to 1 minute and make it emotional. Talk to them and tell them that, see, these are all the things. Give them some time so they are very positive about taking the vaccination. It definitely helps when we talk to them with a more concern and emotion they are happy about what we are talking and they take the vaccine. Yes, John, I'm having, yeah, fine. So ensure right. Okay, what happened now? I'm sorry, something crashed on my laptop. John, can you just take it from there? Mr. John, can you please take my slide share from there? I don't know what happened. I'll try to share it again. Okay, let me see. Yes. No. That's not it.
Dr. Geeta is already contacting, I think, John.
Yeah, I think so. I think my PowerPoint crashed. Some unrecoverable problem is here.
That's technology for you.
I know, exactly. And it always happens when you're the speaker. It doesn't happen when you're an audience.
Murphy's Law, you know.
Yeah. So let me say
okay.
that. So
Yes.
let me continue.
Yes, please. Madam, you have muted yourself.
So keep the words short, have some nice pictures around and talk to them about the vaccination. So then now you have decided you're going to have a lot of questions from this family when you're going to give them the vaccination. Is it safe? Why is it so expensive? And all these things. So I think right now, what I do is I'm waiting for the government to introduce the program. They say the budget is going to come in by March, April, and probably it will be introduced in July, August in the school-going children. But we have a lot of adolescents in the age group of 18, 19, 20. Marriage season is on, and they're all going to get married in the next 6 months. So I request all of you to take time and tell these girls, because they cannot wait for the government to give them the vaccine. They need to take their vaccine on their own. So can I ask, Geeta, is he sharing it?
Yes, ma'am. Yes, ma'am.
Fine, fine.
Yes,
So
yes.
this population, I think you people, I think you'll have to go down. I'm almost towards the fag end of my presentation. Yes, HPV vaccination. Yeah, just go to this. Yeah, quadrivalent. Yeah, quadrivalent. It's okay. Yeah, just move it to this quadrivalent and then move it from there.
Number?
Slide 57.
63.
67.
67, yeah. No, 63. 63, sorry. Let's talk about our Indian vaccine. So now you all know that the vaccination can be given. So start talking early, as I already told you. This is the vaccination schedule I already told you. So they're going to have a lot of questions. So now you may ask me what will happen if the vaccination is missed. 0, 2 and 6 is for all girls from 15 to 26. It can go on up to 45 years. The FOXI guidelines do tell us that you can give it up to 45 years. But if you are giving up to 45 years, you have to do a HPV screening and you have to counsel that particular lady that this vaccine may not protect you for 98 to 99%. It may protect you to 75 to 80%. So you can give the vaccine if the woman asks for it, even after the age of 26. But before that, you need to do her HPV screening. If she is positive, a single shot, they say, because she may be positive for 16 and 18, then you can give her the quadrivalent for the other genotypes which she has not been immunized against. What do I do if I have missed my schedule? If I have missed my second dose, do I need to repeat the first dose? No, you continue from wherever you left off. Then somebody conceives when we are giving them, you've given them the first dose, we've given them the second dose, and she's 18 or 20 years and she conceives. She need not undergo a medical termination of pregnancy if she has conceived. The vaccine is absolutely safe because it is not a live vaccine. Secondly, she can continue her third dose during lactation. This is completely safe for all breastfeeding mothers. Next slide. I hope that point is clear. Next slide. Yeah. So this is what I've already told you. Next slide. Next slide. So waking up to this into 2022, we were all the gynecologists are also celebrating this day when India announced that we are going to come back with an indigenous vaccine, which will be priced. They told us will be 200 to 400, but right now, you know, the price is around 2,000 rupees for a single dose. Okay. But we were very, very positive, and It did come to us for about 5 to 6 months back. It is available as, next slide, Ceravavac is the name of the indigenous vaccine, which is a quadrivalent vaccine. It is effective against all the 4 variants of cancer-causing HPV virus. It is result and it is marketed by the Bill and Melinda Gates Foundation as well as the Biotechnology Industry Research Assistance Council, and it is now being marketed and manufactured by the Serum Institute of India and freely available all over the country. Next slide, please. And we are hoping that they're going to bring down the rate. So usually we were talking about the role of OBGYNs, because the women were more comfortable with us, the women were more coming to us. So, but now what I would say is, please click. All doctors, whatever specialty they may be, they have a responsibility in elimination of cancer cervix by promoting HPV vaccination as well as promoting cancer screening and breast cancer screening. Next slide, please. Next slide. Yeah. So let us all stand against cervical cancer. Please vaccinate girls, do camps, do awareness programs, take it to the society, let our IMA draft some flyers and put it on the social media so that people are waking up, because soon as they saw it in the budget, now people are waking up, the public is waking up. And then there was this celebrity who said she posed that she died because of cancer cervix, and then she claimed that she did it just to create awareness. We don't know about that. Let's not talk about that. Next slide. So maybe it did create a flutter. It did create a flutter in all the social media freaks. So is it possible in India? Definitely. The Lancet in 2019 has said that if Indians, doctors and healthcare personnel and the government makes up their mind, we can definitely eliminate cervical cancer by 2079 and have a very healthy generation next. Next slide. So vaccinate, do the pap smear or a HPV test, because the WHO guidelines now ask us to do the HPV genotyping test for all women above the age of 30 years. If it comes negative, repeat it after 5 years. If it comes positive, we do a triaging with a colposcopy and thermoablation methods, preventing that woman to get cancer cervix, because there is a window period of almost 10 to 18 years when an abnormal HPV test becomes a pap smear, becomes a cancer cervix, a florid cancer cervix. Next slide. Next slide. So let us all put our hands together for a cancer cervix Mukta Bharat. Why, when Louis Pasteur said, when he came out with the ARV vaccine, why talk of cure when you can prevent it? And he came out with the very powerful anti-rabies vaccine. Next, click please. So remember, this is 100% preventable cancer. We wish you all to become ambassadors. Please join this movement with all of us. Next slide. Next slide. So we can all make a difference to all these men and women, I would say, because now I am promoting vaccination for the boys too. When parents come and say, doctor, I have only one son, I have only 2 sons, I said, please bring him along, let us vaccinate him. So let us bring a zero cervical cancer by awareness, screening, early detection, prevention, and support all the programs, the FOXY, the IMA, the KASOGA, the WHO. All of us need to join hands in this movement. Next slide. It is not a one-man show. So definitely there is hope for us. Next slide. So let us put our hands together for a cervical cancer Mukta Bharat. I thank you all for the patient hearing. And if there are any questions, I'm open to that. Next slide, please. Next. Yes. Thank you very much, and namaste for the patient hearing. And Dr. Geeta, my sincere thanks for providing me with this opportunity, and the entire IMA office and all the dear participants who have been with me. I thank you all for the patient hearing, and namaste.
So thank you, madam. I'll take a few questions. Not many are there. A lot of appreciation is coming. So there is one question on YouTube, that is Dr. Abhay Bargaonkar has asked, please let us family physicians know how taking history of patient properly will help us to get a hint for early diagnosis of cervical cancer. I know it's not exactly on vaccination, but I thought it's pertinent. So if you could quickly
So
come inside.
what I would say, sir, first of all, when the history, we have to ask them for any, first of all, whenever they come to us for any other issue, they may be pregnant or they may come as an adolescent for any problem. You need to tell them that these are you have to have personal hygiene. Personal hygiene is very, very important, and treat STIs. Like if they come with persistent vaginal discharge, intermenstrual bleeding, abnormal uterine bleeding, foul smell, burning micturition, or lower abdominal pain, we have to examine them. So a speculum examination is essential for whatever, if they have any complaint regarding the reproductive system. But if you are not doing speculum examinations, please refer them to a family physician or a specialist who is doing a speculum examination. Nowadays, we take pledges to say that I will do a speculum examination for each and every woman who comes to me. So history taking, you will take, sir, of these pertaining to STIs, vaginal discharges, and then make it a habit to do a speculum examination for all those married women who come to you, whether they are pregnant or non-pregnant or even menopausal. So this is some of the history factors. But how can you create awareness among them? Awareness is you should talk to them about personal hygiene, keeping their private parts clean, having a nutritious diet, treating anemia and trying to make them anemia free, make them take good nutritious food, have a very good lifestyle, and sexual partners, be careful with not having multiple sexual partners. And if they are HIV positive, see, if they are HIV positive, there is an increased incidence of cervical cancers, and they are more amenable to cervical cancers due to HPV virus. And these people who are HIV positive, and if they are even below 14 years, they need to take the full dose of 3, 0, 2, and 6. So this is what we did even before the government came out. We had about few children in the child health care who are HPV positive. They were all below 15 years. And it was for these children that we had vaccinated with collecting funds from our own fraternity. And we had vaccinated them free of cost. So eradicating sexually transmitted infections does also prevent cervical cancer, and talking to them and putting them away from early marriages, repeated childbirths, repeated abortions, and general health improvement also helps in preventing cervical cancer. That is the lifestyle modification we need to tell them.
Ma'am, he has also asked, Dr. Abhay Borgaonkar has also asked, any role of smegma in this?
Sir, in HPV, HPV spreads by sexual intercourse. The most common method of transmission is sexual intercourse. And of course, if the men or the boys are harboring the HPV virus, we all know that sexually transmitted infections are more with those who are not circumcised. So probably they are hoarding the virus in their smegma, and they could be, I don't have any studies to substantiate that, but of course, because STIs, we have substantiated that those who are not circumcised, the smegma does contribute to an increased incidence of STIs, and HPV also comes under the same framework of STIs. So probably it would.
Thank you, ma'am.
So that is why we want the boys to be vaccinated also. Let's talk about boys too.
Yeah, coming to that, madam, in fact, Dr. Divya has asked, please share the vaccination schedule for boys.
It is the same schedule. It is in the slide which I have shared. It is the same schedule. From 9 to 14 years, it's going to be 0, 2, and 6. And I think one slide we missed somewhere there. So the same schedule for boys from 9 to 14 is going to be 0, 2, and 6. From 15 to 26, it is going to be 3 doses, sorry. And for those who are less than 14, is going to be 2 doses. That is 0 and 6 for less than 14. Sorry for the mistake. And above 15 years is going to be 3 doses. It's the same dose for boys and girls. And the WHO had come up with another interesting study, and they have made a declaration that even a single dose vaccine before the age of 14 years has created immune response, and that can also prevent cervical cancer, HPV infection. And hence, in low resource groups or those who cannot afford to take even 2 doses, you can always tell them take at least a single dose. And WHO has declared that a single dose can also be used, and it is also approved by the WHO and the CDC. So even a single dose you can advise.
Yes,
Bharti, also to add,
yes,
also
yes.
to add, For boys, nanovalent is recommended compared to quadrivalent.
Yeah,
And
quadrivalent.
by default, if the pap smear, HPV pap smear is positive, we suggest nanovalent vaccine. Of course, the cost difference is
Cost
too high.
constraints. Yeah, the cost constraints have to be kept in mind. But if there is somebody who comes and tells you, I would like to have the nonavalent instead of the quadrivalent, you could always, if they have the affordability, you can definitely advise them to take the nonavalent vaccine.
Ma'am, is as you rightly said, that single dose, and I think some trials have been done even in Sikkim, what I
Yes.
understand.
Yes.
And they've also said the same.
The
But
immune response is good.
Yes, but I was curious to know whether Servavax is already available in the market.
Yes,
if
sir.
somebody wishes to take it.
It is very much available
Very
for the
much.
past 6 to 8 months, I would say.
Okay, it's not just in the government program, but it's also available to general
Government
public.
has not yet come out. It has not yet come out. It has not yet been floated in the government protocol. It has only been declared in the budget.
Declared. Right.
Now the policy makers have to take it to it, the logistics, and probably they say maybe by June, July, another 3 to 4 months, they're going to introduce it in the globe. But right now, we as private practitioners are already giving the Servavac vaccine for the past 6 to 8 months. We have a single dose vial, which costs around 2,000 rupees, and the multi-dose, that is 2-dose vial, is costing around 4,000 rupees. That's for 2 individuals if they come at the same time. Because once it is opened, once it is taken out of the refrigerator, within 10 to 12, 15 minutes, you have to vaccinate the individual. And it can be given on the deltoid or even on the anterior aspect of the thigh. It causes very little pain. Few of them will have mild febrile reaction, just like any other vaccine. And you make them to take rest for about 10 minutes. And then, because you know that these adolescents are so intimidated by the injections, they have vasovagal effects, and then they will blame the vaccine on that. That was when few years back, this vaccine fell into disrepute because there was 2 or 3 incidences where following vaccination there was some death, and later on there is when they investigated, one was a suicide, one was a vasovagal shock, and one was something else. So then that was disproved. And the other thing is, when you give them the vaccine, you talk to them before you give them the vaccine, so they understand. And sir, what we are doing now, we buy the Servavac vaccine from the stockist, or I have requested my in-house pharmacy that I don't want to make profit out of the HPV vaccine. So he gives it to me at a price of 1,800 rupees. So even that 200 rupees makes a difference to that individual.
Absolutely.
And if we buy it in bulk, we tell we are trying to manipulate the company to give it to us at lesser rates, but somehow they're quite rigid. But we are hopeful that in the days as we start giving more and more, as we start vaccinating more people, the cost will come down.
True, true. Again, ma'am, there is a question from Vaishali in the chat. If second dose is missed, how to schedule second and third? I think you already covered in your talk, but I think you can reiterate.
Yes. So if it is missed, you continue. When she comes for the second dose, give her the second dose. And then soon as she finishes that, from the second dose, you take the 4 months from there and give her the 6th month dose. You continue from where she left off. Because it was 0, 2 and 6. So you give her the second dose today on February 20th. You can give her 4 months later the third dose. And suppose she has missed the 6th month dose. She comes to you saying, I've taken 0 dose, I've taken 2 dose, madam, and you give it to her that time. It doesn't matter, but it should be within 1 year. It should be within 1 year of that first vaccination, not after 3 years or 4 years.
Right. Ma'am, one more question from the YouTube I'm taking. Dr. Robinson V. Thomas wants to know that should we coax the adolescents to go ahead with the Servavac vaccine?
Definitely, I would say. See, it is available. It is the preventable cancer, and the vaccine is freely available now. And so you definitely have to coax them, talk to them in nice words, tell them the benefits of the vaccine. What I do when I go to the social awareness programs, the parents come, the adolescents come. So the monetary aspect, generally, it's only the monetary aspect that they are putting them away from taking the vaccine. So we put it across to them. See, your mobile, you're recharging for 400 or 300 rupees a month. You are buying your bicycle, you're buying your cosmetics, you're buying your junk food or whatever your treats which you're buying every weekend. Or, Indian culture, we use a lot of makeup, we use a lot of jasmine flowers, and we are spending on weddings, we are spending on festivals. So I tell the parents, don't buy them a new dress for Yugadi. You cut short your festival expense, but this is going to be the biggest, most precious gift you could give to your kid. And we tell them that if you take it at 14 years and little less, you're saving another 2,000 rupees. You're requiring only 2 doses. So you benefit from that. And then we tell them if you multiply 2,000, 2,000, 4,000, 4,000 for a lifetime will be less than 1 rupee a day. So these are some of the tactics I use in my practice when I try to convince them. And they get convinced and they do take it.
True, ma'am. I think hopefully when the government launches it and also there is some kind of a mass production, probably this will help, like,
Yes.
the cost will come down and of course the awareness will increase. And also let's hope, you said that there is apprehension, especially these youngsters. But with the COVID experience, I think when the COVID
Yes.
vaccine was launched, I think that hopefully will help us, at least one good lesson from COVID, that people will
Very
be
true.
more positive towards, there will be less vaccine hesitancy and more of acceptance. So let's hope that
True,
happens.
Dr. Animesh. COVID has done 2 good things. One is vaccine hesitancy has gone. Second is these online programs.
Absolutely. Absolutely.
These are 2
I
things
totally
that
agree.
we have benefited from COVID.
Yeah, we have all become adaptive to this. Otherwise,
Yes.
this would have taken probably 5 to 10 years at least.
Right. Yeah. So I think, and now that the government also has announced it, people are going to be more proactive. But let's not see, we need a private-public partnership because the government cannot cover this huge population of ours to vaccinate. So let us leave the government protocol for those who are needy, who are economically compromised, and let the other well-to-do society who come to the private sector try to take their vaccine on their own. So that way we can vaccinate more and more people.
True. Maybe CSR or something somewhere can be tapped.
No, CSR funding we do see the Red Cross, the Rotary has taken up this project of HPV screening. I don't know. I'm not a Rotarian, so I don't know whether they fund vaccination, but I think they do fund
not
the HPV screening.
I am a past Rotarian. I mean, I've left after a decade. So, but I don't think, ma'am, to my knowledge, I don't think.
No,
but
I think
probably,
some HPV screening programs they're taking up. Yeah.
Screening is done.
Programs they're taking up.
But they may take up, ma'am, because
no, ma'am, it's not there.
It's not there.
It's not there in
We have our Soumya Mani, who is our Rotary governor here from Assam.
Yeah. Ma'am, do we need to extend the regime beyond 45 years?
No. This is, see, even up to 45 years, you need to counsel them and talk to them and tell them that this may not give you full protection. You have to continue with your screening. And there's one more point I want to tell you here. Though the individual is vaccinated with HPV, the routine screening protocol for cancer cervix from the age of 30, we have to do a HPV test, or from the age of 25, we do a pap smear by the liquid-based cytology test. We have given up the slide method. The LBC method we have to do of the pap smear from 25 years, every 3 years. And if it is negative for 3 years, then you can switch over to 5 years up to the age of 60. If you're doing the HPV test, we start doing from the age of 30 years, irrespective of whether she is vaccinated or not. She has to be screened. If the test is negative, she repeats it every 5 years up to the age of 60 years. Okay, and along with that, for vaccination, if she says my HPV test is negative and she's 40 years, you can give her the vaccine, but you need to tell her that this is only a quadrivalent or a nonavalent vaccine, but there may be other causes of cancer cervix. It could be not squamous cell carcinoma, it could be an adenocarcinoma or a clear cell carcinoma. So the regular screening protocol cannot be given up just because I have been vaccinated. So we don't vaccinate beyond 45 years.
Right. So I don't see any further questions, ma'am, and I think it has been very exhaustive and very good discussion.
Thank you.
You had a very comprehensive presentation. And of course, I can see here. Thank you, ma'am. And
thank you for chairing my session.
And appreciation coming up. So
thank you.
With that, I think we could close. Geeta,
Yes.
ma'am?
Yes,
one question.
Presentation, madam.
One question. Dr. Suresh, sir.
Yeah.
Dr. Suresh wants to ask. Yes.
Yeah, madam. Bharti, madam, one question.
Yes, sir.
Like a cancer prostate, we have got some screening test like a serum PSA. We are doing serum PSA.
Yes,
but in India, it is still not recommended that all the elderly male patients, we recommend the serum PSA as a screening test. So, like this, in India, this HPV DNA test, is it recommended for all the women?
Yes, sir. It is recommended for all women above the age of 30 years. It is now cancer cervix screening has come under the non-communicable diseases forum I told you. If you cannot do the see that's the WHO recommendation. The WHO and the CDC recommendations say that the HPV screening by the genotyping, hybrid genotype technique has to be done. But again, we have financial constraints and logistic constraints there. So everybody is not, see, for example, in the public sector, they do not have the logistics or the financial support for that. So we even do a screening by a visual inspection of the cervix and just put diluted acetic acid on the cervix and try to identify whether there are any abnormal lesions or doubtful lesions, and then take them up for a pap smear, which is available in all public sector hospitals. And if the pap smear you see some iodine negative or acito-white epithelium, then you can take, if the pap smear shows some abnormal cytology, you take them up for colposcopy. And after colposcopy, that is also available. And I think the recent budget, you must have read that they're going to put colposcopes in many, many hospitals also. They have allocated some 20 crores for colposcopes. So colposcopy training, and we do the colposcope, we pick up the doubtful lesions and we do ablative techniques. We don't do surgical techniques, or we don't do a hysterectomy for them. We have wonderful ablative techniques like cryotherapy, thermoablation, and leap excision. So large loop excision of the transmutation zone. So we remove that and we prevent them from cancer. So the rule is we have to screen. The guidelines, not the rule, is the guidelines by the Government of India is all women about 25 years have to be screened by the pap smear. But now we are transforming to the LBC, liquid-based cytology, because the pap smear slide technique has a lot of subjective and objective errors, and the sensitivity is less. But however, the LBC is better, or even just a visual. We are training our healthcare workers to just put a speculum and just put some acetic acid with a cotton tip and just see if there are any acito-white lesions, refer them to the nearest referral hospital where effective treatment modalities are there. So just as you said, I told you, even men have to be screened for whatever colonic cancer and prostatic cancer and liver and oral cancers, men and women, because this is a cancer prevention day. So I think we have to take up the prevention protocol, not just for cervical cancer, but for all cancers, because as you all know, with today's lifestyle, I don't know whether it's a lifestyle or earlier detection or better screening techniques, we are seeing an alarming rise in all sorts of cancers in the population.
Madam, I am Dr. Surendra calling, madam.
Namaste, sir.
Namaste.
Dr. Surendra.
I am a practitioner in Bangalore since 50 years.
Yes, sir.
Dr. Anuradha has told me this webinar today. I am in New York. And my opinion, even in 15 years back, when a TV channel has come to give an advice for the general public, I told about HPV vaccination at that time also. And one more thing, always we will be discussing about money. I am telling medical people, if you suggest properly to our patients, definitely it's an amount nobody will think, madam. Everybody, only thing, we have to counsel them, madam. That is the most important. That is the most important.
Dr. Surendra, sir, first of all, I thank you with folded hands, and my pranams to you for joining all the way. That shows your commitment for the betterment of human health. And as you rightly said, sir, we need to talk about it on every occasion. And as you said, my patients, whoever come, I talk to them to convince them, give them some time, and they don't refuse the HPV vaccine. The second thing, they don't even refuse the HPV test. We are trying to get the HPV test done, sir. We are doing it around 1,200 rupees, 1,300 rupees, sometimes 1,000 rupees. The pap smear costs them 300 to 400 rupees. So when we tell them, see, this is a more sensitive test, this is more effective, they do come. If they don't have the money, they come back next day and they get it done. So as you said, if we talk to them, when it comes with the correct words from the correct person, definitely they will take it up. Money, they will somehow manage to get the money.
Yeah. Money is not the question.
I truly agree with you for that, sir. I truly agree on that point.
Thank you.
Thank you, sir. Thank you for joining from there. Thank you very much.
Thank you very much.
Any questions from anyone? Kindly unmute and ask any question if it is there. So I think most of the doubts are clear. And as we said, madam, first we doctors should be convinced. Many times,
1 minute.
Dr. Soumya.
Ma'am, suppose if the HPV DNA it comes as positive, what we are supposed to do? Whether we wait or we treat, how long we need to wait?
see, once the HPV test, what is negative? You have to see whether the 16, 18, the high risk genotypes are positive, or it is the others. That is the 32, 35, whether that is positive. So unless you do the HPV genome hybridization and DNA typing, just getting a report as HPV positive is not going to help you much. Okay. So that is important. Which test are you getting done? So once you get HR 16 and 18 positive, you are supposed to triage the patient. So what is this triaging? You have to do either LBC pap smear, or you can directly take her up for a colposcopy.
Okay.
You are a colposcopist or somebody is doing colposcopy, send them there for a colposcopy. So we do a colposcopic directed examination, and that is a screen and treat method. It can be done at one sitting. When we do the colposcopy, and if we feel that the score is high and that it could be already cancerous, then of course we just take a biopsy and we wait for the biopsy report. But if the colposcopy score is less, and we know this is only a precancerous lesion, you can see the transformation zone. You can go for the ablative techniques like the thermoablation or the cryoablation. But if the transformation zone is deep inside and you're not able to see it, then you will have to go for the excisional techniques, that is the large loop excision or the loop excision, because you have to remove the transformation zone. The idea is when you destroy the transformation zone, which is the very labile dynamic area of the cervix, which can become cancerous, either by ablative or excisional methods, you have to follow the patient later on every year. Annually, you have to follow her up. So there's no point in just saying HPV positive. It has to be, is it high risk or low risk genotypes?
When suppose the HPV is positive and the low score, no obvious lesion and colposcopy, what should we do?
No, just follow her up next year. Ask her to come back for a follow-up.
Every year.
You can vaccinate her. You can vaccinate her with monovalent vaccine.
Yes.
Okay, ma'am. Thank you, ma'am.
And repeat HPV testing after 1 year
Next
instead
year.
of 5 years.
Yeah, after 1 year, you have to repeat. Not wait for 5 years.
Yeah. Thank you, ma'am. Very nice,
Soumya.
very informative presentation. We are proud of you. Thank you.
Thank you very much. Thank you.
Bharti, I request you to once again tell all our cross-speciality doctors to speak about HPV vaccination.
Yes, let us make it that when we say namaste to everybody when they enter our clinics, or we say good morning, just before the 15 seconds, we just ask 15 seconds of all, whether you're a surgeon, you're a urologist, you're a plastic surgeon, you're a neurosurgeon, it doesn't matter what you are. Okay, because when a couple walks into my hospital for the wife's problem, after that I tell that man, please get your blood pressure checked, please get your diabetes, PSA checked, go and get your cancer screening done, get your ultrasound done, get your prostate PSA antigen. So similarly, male, female, whatever specialty you are, wherever you're sitting in metro, corporate hospital, small clinic, no, please do talk about HPV vaccination and cancer screening. And if you are not doing a speculum examination, please refer them to somebody who does a speculum examination, because we have seen of late less, but earlier days in our practice, we have seen many women taking treatment for anemia, lower abdominal pain, and when they come to us, we are seeing a florid cauliflower growth of cancer cervix, and that poor lady had been going to some hospital or a doctor for the past 1.5 to 2 years. It has happened. These are realities we see. So we don't want to see these cauliflower growths and invasive cancers in future. So a sincere appeal from all of us, from the Foxy, from the Kasoga, and from IMA, please do talk about cancer prevention for men and women, and about HPV vaccination and HPV screening. And if any of you who are doing cancer cervix screening, if you want any updates on the HPV laboratories doing it and all that, Dr. Anuradha or myself can give you the updates on that. You're free to contact us anytime. Thank you very much. I think we have overstepped our time.
No problem. Yes, I hope everyone's doubts are clear. First, we doctors should be convinced actually about HPV vaccination, because most of the times the doctors themselves are not very convinced and they don't advise their patients. So now we are bringing awareness among our doctor community that this vaccine is so important. Okay, then next is, now when they are going to start shortly the vaccinating the girls in the schools, definitely our role is going to increase, because that time the patients are going to ask us, or the parents are going to come and ask us the doubts regarding the vaccine. So that time we must be ready to answer their questions. And thirdly, yes, definitely, each one of us should spread an awareness. Yesterday, I just shared this talk brochure on my WhatsApp status. I got so many patients or so many well-wishers asking me, what is HPV? What is HPV vaccination? So from 2-3 days, my awareness program has started on WhatsApp only. So actually, then I realized no one is knowing about this HPV vaccine or HPV virus, what it is. Then I started telling them what is it. So for the people in the community, they are really not at all aware about the HPV vaccination. So we have a great role and a management task in front of us to create an awareness wherever possible, in the schools, in the colleges, then in the inner wheel clubs, Rotaries, Lions, wherever we get an opportunity, we should spread an awareness about this HPV in a combined way. As Madam said, Foxy, Kasoga, IMA, everyone, IAP and IAP NSM, sir, your community medicine, everyone should join hands, and we should see that we have a good percentage of vaccinated girls or screened population in India, because we saw such a poor statistics. Only 0.1% of the girls are vaccinated as compared to 60 to 70% in the developed countries. So we are far, far, far behind. So let us at least be in the race, not leading, but at least let us be in some competition with the developed countries in this HPV vaccination now, because Survivac 2000, where a nanovalent vaccine was 10,000 rupees, this is only 2,000. So definitely it will be easier for us to get more and more girls and boys vaccinated. And definitely, as Madam said, those who are affordable can purchase it, and those who are really in the needy or who are economically weaker sections can get the benefit of the government vaccines. So extremely thank you, Bharti ma'am and Animesh sir.
Thank you, Dr.
So just for a formal vote of thanks, I request our Honorary Secretary, Dr. Suresh Kagalkar, to give the vote of thanks.
Thank you, Dr. Geeta Dappa madam, for giving me the opportunity. The respected President and Honorary Secretary and all the office bearers.
Sir, you are unmuted. You are muted.
Yeah, important topic, that is a cancer cervix Mukta Bharat. It is very good topic, and it is a every individual, every citizen responsibility that everyone has to know regarding the cancer cervix. And as the madam slides, we came to know that the US and India, the scenario of the cancer screening, HPV screening, as well as this vaccination schedule is very, very alarming. So that much we came to know, and in India we have to struggle a lot. We have to have a full vaccination, 100% vaccination and screening program, and it is everyone's responsibility. With this few words, Madam has given. It's very important topic, and it is not only any doctor; it is all the doctors. All the doctors has got a responsibility, irrespective of the specialty. So everyone. So I thanks to our beloved President, Dr. Srinivas sir, who has given opportunity to conduct such a good informative program. Thank you, Srinivas sir, and also sir has met our beloved Health Minister Gundu Rao sir, and has this recently government has introduced some budget to have a government vaccination program. This is very good and added advantage to the health sector. So thank you very much, sir. Srinivas sir. And also, I thank to our Honorary Secretary, Dr. Karunakar sir, and he is timely joined and has always supportive for any of the program whenever we call, and sir is always encouraging. Thank you, Srinivas Karunakar sir. And also, I thanks to our important speaker, chairperson, Dr. Animesh Jain sir. Last time also, sir, I joined along with us in the different association of the IMA, and having the chairmanship. And thank you, Animesh Jain sir, for your valuable time. You have joined and good informative, and also have discussed many of the inner things which we don't know. And that is very much thank you. And thanks to our beloved speaker, Dr. Rajshekar madam, who has very good informative, and everyone is very happy, and everyone came to know that many of the important hidden ideas as well as doubts we have got, and we came to know many of the things. Thank you very much, madam, for coming all the way from the IMA KSP. And we request in future also your informative talk as well as your support is needed in Kasoga also.
Definitely,
In the,
sir.
yes, madam. Thank you very much, madam.
Definitely. Thank you, Dr. Suresh. Thank you very much.
Lakol sir for joining and having good information. Thanks to the Anuradha Parmesh madam and Nirmala madam also joined. And I thanks to the all the members and all the chairpersons of the different IMA KSB the sectors, especially Padma Prakash madam and others, Savita madam, and everybody has joined. And I thanks to everyone and our chairperson, our chairman of IMA KSB AMS Association of Multispecialty, Dr. Geeta Dappa madam, has introduced a very good topic and has taken a new initiative for this cancer cervix, especially the World Cancer Day. It's a very good informative topic, as I say. And all the viewers of the YouTube, I thanks to everyone who are viewing and having a doubts. Even if you have got, you can call anybody.
Sir, you.
Yeah, and thank you everyone for viewing, and thank you everyone for who have joined, and thank you all the YouTube viewers. We'll see you in the next month with a different topic with a good speaker. And thank you. Good night, everyone. Thank you, Anand. Thank you. Thank you very much.
Yes. Thank you. Yes.
Good night. Good night,
Yes.
everyone.
Thank you.
Yes. Thank you very much, Bharti ma'am. Thank you, Dr. Animesh. Yes.
Thank you, ma'am.
Thank you very much.
Thank you.
Some effective programs.
Yes, madam.
Okay, and
Because
I think
we
IMA
have
can
to-
do some short video clips.
Yes, that's what we
Put
are
on
planning,
the-
because seeing the public not knowing anything, even I thought short clips we can have.
Some
and
short clips